session, please.
Yeah, good evening, everyone. Welcome to the platform of Orthopedic Research and Education Foundation India. Today, we have Dr. Ganjwala sir from Ahmedabad, and who is teaching us about a guide for better diagnosis and decision making in orthopedics, so that when you have some difficulty to diagnose and what we all need to know in that condition, sir will explain for that. So, thank you very much, sir. Over to you, sir.
Yeah. Yeah. Thank you, Janki, for the introduction. And thank you very much for the invitation. Now, first of all, let me tell you that if you have expected that I'm going to give you some tips about how to make diagnosis, then I'm going to uh, make you feel that you have not learned anything. But I also must say that I'm a pediatric orthopedic surgeon, but this lecture is nothing to do with pediatric orthopedics. It's more of a psychology. And once you understand why this lecture is important, I will explain you the relevance this with the practice. So a few years back, I was teaching the postgraduate students and the physiotherapy student how to make a diagnosis. And in that, one of the topic or like the question I had was why we can't make a true or the correct diagnosis. And that question led me to the revealing that there is a very big science behind that. And that science I'm going to tell with you. So I'm going to talk about the thinking traps. So first of all, I would like to ask you questions, the three questions. Why do experienced doctors sometimes make a wrong diagnosis? That's the question. Number one, you can think about the answer in your mind. The second question is like, if two doctors are given the same information for a same patient, one makes the correct diagnosis and the other person cannot make the current diagnosis or the correct diagnosis. So the question is, what could be the reason for the same? Why second person cannot make the correct diagnosis? And the third question is, what do you think as a cause for a diagnostic error? So I'm giving you a few options. The first is lack of knowledge. The second is not taking proper history. The third is not examining the patient properly. The fourth is limited investigations. And the fifth is some problem in the thinking method. I'm sure that you would say that all the five are correct or possible for diagnostic error. But if I ask you, like, what is common in all the three? The answer, the three questions which I ask, the answer to the three questions which is common is thinking traps are the reason for we are not able to make proper diagnosis. So first of all, let me give you the outline. The first point we are going to discuss is I will explain you what is the thinking trap. The second part, which would be more like 30 minutes or so, why it is important to know about the thinking trap and what are the thinking traps, that we will discuss in the second part. And lastly, for a few minutes, we will understand how can we prevent these thinking traps. So let's start with the first question. What is thinking trap? We know that the brain is the one organ which made us superior in the animal kingdom. At present, the mankind rules the animal kingdom, and one of the reason for that is brain. Brain has a lot of function. Of that, one function is thinking. And as a doctor, we think a lot. The question is that why does our brain sometimes function erratically? That's the question which we are going to understand. The reason for erratic functioning of the brain is brain uses shortcuts. So what is that I will explain you in a minute. But please remember that for use of brain requires a lot of energy. And to save that energy consumption, brain uses some shortcut so that it doesn't have to think all the time. Let me give you one example. If I ask you, which is the color of this word, most of the people would say red. The correct answer is green. The reason is because for reading, brain requires less processing, while for finding out the correct color, brain requires more energy or more processing, and brain tries to save energy. And so most of the people, when asked what is this, they say that it's red. Now, one of the theory that why we use shortcut, when we were in a hunter and gatherer stage, there were a lot of threats surrounding us. And at that particular time, to fight against that threats or to survive us against the threat, brain has to take quick decisions. And for that, brain requires some short. So evolutionary, we started using shortcut. And it said that the two group of people got separated. The one is a slow thinker and the other one is a fast thinker. The slow thinker took a lot of time, and because of that, they succumbed to predators. So it said that the slow thinkers have vanished inside the predator. And most of us are the descendant of the fast thinker. So all of us are a fast thinker and we think very quickly. And for fast thinking, brain uses shortcuts. These shortcuts are really good and they help us most of the time. There is no question that they are really bad. They use or they help us most of the time. But occasionally they create problems. And this problem are called thinking traps, or the another word is cognitive error. Cognitive is the brain thinking function is called cognition, and the error in that is called cognitive error. And in the pure psychology, it's called cognitive biases. Because I want to avoid the word cognitive bias, I am using the word thinking traps for this lecture. So this thinking traps happens without our knowledge. Even I may be having thinking traps, and I will give you some example during the lecture where I have also stumbled upon these thinking traps. Again, it's not a sign of low intelligence. And even smart people, they have made such mistakes, such they are stumble upon such traps. If you go back and read the history, you will come across n number of examples where a smart people have made such mistakes, and it's not because they have done it voluntarily, but it occurs subconsciously because our brain uses shortcuts. We as a doctor are prone to err, and the reason for that is we are not systematically trained how to think slowly. Sometimes we are in hurry because we have to see a lot of patients. If you are in a general hospital, like you have to see 70 or 100 patients in 2 or 3 hours, and really you can't spend much time, and so you start using shortcuts. And then ultimately your brain learns that yes, shortcuts are good, but it's not good when we come in a practice. In addition to that, we are surrounded by a lot of distractions, a phone call or some noise, and that again a reason that we succumb to these thinking traps. So I consider thinking traps are something like that. If you are not careful, then you would stumble upon it. But if you are careful, you can definitely avoid falling. And that's the reason I want to make you aware so that you can prevent those thinking traps. So before we move on to the second point, I would like to give you another example of a thinking trap. In one major city, they put a board like this, that this area or this zone is a no parking zone. And if you park your vehicle over here, then you will have a penalty of 250 rupees. As you see in this picture, people have parked their vehicles over here. Someone had a thought that let me try something differently. And then the question was, how can we enforce the law? So someone came up with an idea and he displayed a board which says that this is a parking zone and parking fee is rupees 250. So what he done, he changed the wordings and instead of penalty, he converted this into rupees. And as you can see over here, there are no vehicles parked in this zone. Why? Let us understand. This is called a thinking trap, and the name of that thinking trap is called the framing effect. How you put the information that determines the response of other person. In the first example, it was shown as a penalty. And because of that, people discounted that information. They didn't pay much attention to the information. But in the second example, it was shown as a price that 250 rupees is the fee which you have to pay. And when it was a price, people considered that it's too expensive or too costly, and they avoided parking. In both the situation, it's 250 rupees. And there should not be any difference in the decision of a person. However, the way the informations are put forward, that's the way our brain analyze it or perceive it, and that is how it behaves. We will show more example during the lecture also. So now we come to the second point, and this second point is about why it is important to know about this thinking trap. Before I answer this, let me give you the information that how common it is in medicine. Because you must be thinking that we all are smart, we are all doctors, we are the brightest people of the society, and this is not possible. We are very good thinkers, and there should not be such thinking traps in our thinking. So I will be quoting two studies. There are at least 10 such articles which says that thinking trap is always there in our decision making, but I'm going to give you only two. The first was published in 2013, and that's again a Journal of American Medical Association Internal Medicine. And the study was carried out for a primary, like a study of 190 diagnostic error in primary care practice. And thinking trap were present in over more than 80% of the cases. So that shows the magnitude of this thinking trap in our practice. I'm sure that you would not accept this 80% results, because you would always say that no, this cannot happen. We are so smart and we can't make 80% mistake in our diagnosis. The second study, 2016 study, emergency medicine study, and in emergency medicine department where people has to think very quickly, 91% of the reported errors were because of the thinking trap. So the first study says 80%, the second study says 90%. So definitely it is much more prevalent than what we think. Now this thinking trap can affect us two ways. The first, it may affect our diagnostic ability. And the second is it may interfere with selecting the right treatment. So we will see few examples of this two. The first is diagnostic ability and the second is selecting the treatment. Because as a doctor, we do this all the time. If we are a surgeon, then we need a skill for surgery, but all doctors, they definitely require a diagnostic skill, and they also need a ability or a skill to select the right treatment. So let's start with the thinking traps that affect diagnostic skill. Before we go into that, let's understand the process of diagnosis. We all know that we make diagnosis based on information. There are three sources of information. The first is from the history. We try to gather information from the patient via asking questions. The second source of information is examination. We carry out a thorough clinical examination and then we gather some information. And the last, if we are not able to make diagnosis based on the history and the examination finding, then we ask for investigation. Now we know that this is the source of information. Now this source of information comes to our brain, and very few people really pay attention to this, that when this information reaches the brain process that information and ultimately it comes out as a diagnosis. So we pay attention to history taking, we are taught about examination, we are taught about investigation, but we are never taught about what is happening in our mind. And that's the reason that we never pay attention to that, and that's the source of error. So let me give you one incident. It was my first week of residency, and we had 6 senior people in the department, and I was the 7th one who joined. In one of the round, our professor showed one X-ray and started asking a question, what do you think? I was the junior most only. This was my first week in the orthopedic residency. So I was not knowing much, but from the X-ray, it was evident that diagnosis is this. He started asking the senior most person. The senior most person said something which, according to me, was a wrong answer. So after that, my professor asked the second in the cadre, and he also said the same. According to me, that was a wrong answer. One by one, he asked all the 6 senior people, and all of them gave the same answer, which was wrong. According to me, I was the 7th one, and I was really in dilemma because my answer was different than the 6 senior people. And I was debating whether I should say what I feel correct, or I should say the same diagnosis which 6 experienced people with a more experience than me, they are saying. So I suppressed my answer or my thinking, and I followed the thinking of my senior. After that, my professor told me something which still resonates in my mind, and I am very clear about that. He said that, Dhiren, learn to trust yourself. Don't just follow others. Later on, I come to realize that all the 6 seniors were told beforehand that they were asked to give a wrong answer. So, what my professor was doing, he was testing whether I am able to tell my answer based on my thinking or I'm just following the other people. And I failed in that. This was a standard thing every time when there is a new person in the department joining the department, he would carry out this exercise. So all the 6 seniors has also undergone the same thing, and that's why they were giving the wrong answer, and I become also the victim of that thing. But I learned one thing, very important thing, from my professor, to trust my own thinking rather than following others. So let me ask you a question. Which city is the capital of Canada? I am giving you two answers. The answer A is Toronto and answer B is Ottawa. So I request you to unmute yourself and quickly say, what do you think? Yeah, please unmute yourself and answer the question.
Ottawa.
Okay. Ranjan? Okay, fine. So the correct answer is, yeah, please.
Yes, Rishu.
Um, I don't know, sir.
You don't know. Okay, fine. Good. So the correct answer is the capital of Canada is Ottawa. Now to explain you, let's say this, that the person in the green is knowing the correct answer, that the correct answer is not Toronto but Ottawa. So he has a understanding that the correct answer is B. But you see, the first person, second person, third person, fourth person, fifth, saying that the Toronto is the capital of India, the Canada. And after listening this people, he would change his answer and make it that the capital of the Canada is Toronto. So this is called the conformity bias. So what is that confirmatory error? The tendency to change your thoughts or your answer so that it matches with the group, even if you disagree. This is one of the principle of group dynamics, that when people are in the group, they look at what other are thinking and accordingly they change their views or the vote. Why this is important for you in the practice? So let me give you an example. A young doctor, a very bright person, he started a private practice in Gujarat. One very reputed or the famous person, industrialist of the city, he came to this orthopedic surgeon for the diagnosis, and the orthopedic surgeon examined him and came to the diagnosis that this is the pain in the knee joint, and that's because of the pes inserinus bursa. However, all the 5 orthopedic surgeons to whom this gentleman has consulted, all of them said that this is osteoarthritis of the knee. Now, for this young person, all the 5 senior doctors has given something else as a diagnosis, and they have suggested a treatment based on that. Now, he will be in a dilemma whether to say that his opinion is different. So you will come across this situation very frequently when you will start the private practice. And to avoid this confirmatory bias, what I do, whenever there is a patient who is coming to me for the expert opinion, and when he has consulted 3 or 4 other surgeons, I look at all the previous reports. I look at all the blood reports. I look at all the x-rays, all the investigations which is with them. But I don't look at the previous consultant notes. Because the moment I look at that, there is a possibility that I may become a victim of conformity error. Let's take another case. A elderly person, 75-year-old male, presented to orthopedic surgeon. This gentleman, this 75-year-old male, had a compression fracture before 2 years. Now he presented with low back pain for last 15 days. So this young orthopedic surgeon attributed this low back pain to the osteoporotic compression fracture. What do you think about this? We need to remember that, yes, there is a past history. We should take the past history, but giving too much of importance and don't thinking about the other possibility and attributing low back pain directly to osteoporosis or the past fracture is called a bias. And this is called an anchoring error. So what is anchoring error? The tendency to rely too heavily on the first information that one receives while making decision. So without taking the proper history, without examining the patient, we just rely on the first source of information. That is, there is a past history of compression fracture. And based on that, we say that this is because of the past compression fracture. This is too much. You really need to exclude the malignancy at the age of 75 or degenerative spondylosis at that age. So I consider this as a situation in which a drowning man who tries to, or like he clutched the straw and then he tries to save himself. The same thing happens with the first information and we try to make the diagnosis based on that. Coming to a different situation, a 65-year-old lady, she had a pain in the right shoulder. There is no tenderness, range of motion is full. You suggested imaging and the blood investigation. And in that, the serum uric acid is 7.5 milligram per deciliter. And because this is abnormal, you start uric acid lowering treatment. So this is again a thinking error. When you ask for an investigation, the first mistake is like without putting a differential diagnosis, you just ask for a broad set of investigations. And in that, one of the report is slightly abnormal. And then you attribute the pain to that condition. In here, we call it a hyperuric acid, and that's because of the leading to the gout. So that's the wrong thinking pattern. So this thinking trap is called the confirmation error. That's the tendency to consider information that supports existing belief while ignoring what contradicts the other information. How to avoid this error? For that, I would like to give you the example of Charles Darwin, the person who described the theory of evolution. And he says that whenever I encountered an observation that contradicts my theory, I record them immediately in my notebook to ensure I would not forget them. So whenever we have a two set of information, the one which is fitting with the theory, the other is not fitting with the theory, it's human mind that we tends to neglect, which is not fitting with the theory. So to avoid that, we need to always ask what informations are not aligned with my probable diagnosis. Don't rely only on what is aligned with your diagnosis, but also think that what is not matching with your differential diagnosis. The another situation during my residency, I had a dispute with a colleague. So ultimately, it got to a higher level and we decided to meet the professor. So both of us went to the professor's cabin, and soon on entering, my professor immediately start scolding me. I was a bit shocked and surprised that without asking me the details, how could he decide that I am the culprit? So I felt very bad. Later on, my professor came to know about the exact fact, and then he called me and apologized profusely that Dhiren, without knowing the correct information, I scolded you on that day. So that remained in my mind. Few days after that, there was a 32-year-old gentleman. He presented with the right hip pain. He was from a poor socioeconomic background. His hip range of motion were terminally painful. His blood counts were normal, but ESR was raised. And based on this three piece of information, that is from the poor socioeconomic background, the hip range of motion is terminally painful, and ESR is raised, I made a diagnosis that this is tuberculous hip. So at that point, my professor told me that Dhiren, on that day, I made the mistake, which is called the premature closure error. Without having adequate information, I came to the decision, the same mistake you have made, that without having adequate information about tuberculous hip, you hurriedly made the diagnosis about this. So that is again an error, the premature closure error. Now, before we move on, let me ask you a question. Suppose you have registered for a conference. In that, there were residential package, and you have opted for a twin sharing room. Then, when you reach there, the organizer asks you to share a room with a person to whom you don't know. They give you the information about that. The first person option is Ajit, who is smart, who is hardworking, he is impulsive, he is critical, and he is stubborn. And the second person is Binu, is jealous, is stubborn, is critical, is impulsive, is hardworking, and smart. So with that information, with whom you would prefer as a room partner? Most of the people would consider Ajit as a room partner. But if you look at carefully, all the 6 criteria which has been given for both the candidate, they are same, except they are in a reverse order. However, because we hear about Ajit as a smart and a hardworking person, we decide to go ahead with that person. So that's called the primacy effect. We remember or give more importance to the information that we hear or see first. So that is again a thinking trap. Now we are coming to a few errors which we make in selecting the right treatment. So let me give you an example. Like I was going to Allahabad, and on the road I ate at dhaba because it was a long journey and we were supposed to reach late at Allahabad. So I decided to take a dinner at dhaba. The next day I had a very profuse diarrhea. So I decided that I will not take anything in the future at any dhaba, because I remember that past the bad experience of having a loose motion, and that disturbs my next day completely. And so that bad experience made me to take a decision not to eat anything at dhaba. Let me give you the medical example for the same phenomena. The Dr. Prakash, he prescribed one NSAID to his patient. After taking this medicine, the patient developed a rare side effect. However, that was a very serious side effect, and patient was admitted in ICU And after intensive treatment, fortunately, the patient was saved. However, patient has to remain in ICU for 3-4 days and has to spend 1 lakh rupees for the treatment. After that experience, Dr. Prakash never prescribed that medicine again to any patient. On the other hand, many colleagues have found this medicine safe. So why Dr. Prakash is not using this NSAID, which had given a problem to the patient? The reason is because the bad emotions attached with that episode is not allowing him to prescribe this medicine again. Now let's see how it interferes with in our practice. I'm going to give you 2 scenarios. The first, Dr. Sharma has started a practice. He carried out a total knee replacement. He got a very good result. So next time he has a similar patient who had osteoarthrosis. He carried out examination, investigation, and come to the judgment that this is osteoarthrosis of the knee joint. However, this patient had not taken any treatment in the past. So now, prescribing non-operative treatment to this patient, Dr. Sharma straightway suggested TKR. Why? Because he had a good experience with the TKR with the patient whom he has operated. So he decided to go for TKR in this patient. The another Dr. Mishra, he treated one patient with varus derotation osteotomy. One patient of Perthes came to Dr. Mishra and he treated with varus derotation osteotomy. The outcome was not good. Patient did not improve. The pain persisted. The range of motion did not improve. The lurch persisted. And patient and the family both were unhappy. And every time they come in the OPD, they make comments about Dr. Mishra. So learning from that past bad experience, the next time the patient had Dr. Mishra had a patient of Perthes disease, he suggested non-weight bearing to that patient because he has realized that surgery is not giving good result. So he suggested something else and he suggested non-weight bearing. Now remember that both these incidents are emotion-driven thinking traps. The past mistake made us to think that XYZ is good or XYZ is bad. Another example, after Second World War, the military and the Air Force, they came to know that they tried to retrieve the fighters, and they realized that these are the areas where there are the machine guns were attacked and these flights were damaged, or these fighters were damaged. So they were trying to find out that we need to do something to strengthen this area. Now, before they took any decision, one mathematician called Wald, he entered into the picture and he said that don't do like that. Don't pay attention to these areas. You need to pay attention to other areas. Because when the bullet or the gun struck at that area, this plane could not come back. They were lost permanently. So what you are looking is those fighters which return, but you are not taking into consideration which fighters were damaged and they could not be survived. The question is, let me give you an example, medical example. Dr. Patel met me and he said that I have treated 400 plus patients with treatment Y. We are not going into detail what is a treatment Y, but he said that I have treated 400 patients and all are very happy. They all have become all right. So when you listen something like that, you have to think twice. So let me give you an example. I'm showing you a 400 patient in the form of 40 patients. So Mr. Patel had 40 patients. He gave a treatment Y, and after treatment Y, 10 out of 40 become all right. The 30 out of 40, they were not better. So these 10 who were better, they continued coming to Dr. Patel. And so based on that, Dr. Patel thought that all the patients are better. Actually, it's not all patients. It's only the 25% of the patients, they are better with the treatment. But when we don't look at all the patients, we just come to a wrong conclusion that all the patients are better with this treatment. This is called survival bias. Mistake on focusing only on people or things that succeeded while overlooking those that failed or those who are not visible. So whenever you read an article, the question is that how many patients were enrolled and how many patients they were followed up. If there is a big difference between the two, as I showed in the example, then you have to discard the result of that treatment. Now coming to another thinking trap, which is nowadays very rampant in our society. Let me give you an example. Your batchmate is on vacation. He posted a picture of him and his wife on the Insta. You look at the picture and then you know that this is an extensive trip. You have already started a practice and you have taken a huge loan which you have to pay in next 10 or 15 years. In addition, you are planning a IVF treatment, and without taking all these factors into consideration, you decide to go to the same place where your friend has gone. So why? The reason is called a bandwagon effect. What is bandwagon effect? A psychological phenomena in which people do something primarily because other people are doing it. Nowadays, it's called the FOMO, the fear of missing out. That's again another name of bandwagon effect. We see this bandwagon effect many times after the live surgery session. You attend a conference, the live surgeries are demonstrated over there, the experts are doing it, and that gives you the feeling that, oh, everyone is doing this procedure, let me start doing it. And you return from the conference and then you start doing that procedure, and then there is a complication. That is again a bandwagon effect. You want to join in a bandwagon where everyone is doing the same surgery. Another example, Dr. Shah, he is a Elizaro method specialist. So any patient with a fresh fracture, simple oblique fracture, the comminuted fracture, non-union, whichever is the fracture, he tries to treat these patients with Elizaro method. This is again a thinking trap, and it's called Maslow's hammer error. Means if you have only a hammer, you tend to see every problem as a nail. So that's the Maslow hammer effect. The last thing, Dr. Atul, who is in a practice for more than 20 years, for postoperative pain, he continued using Fortwin and Phenargan, which he used to use when he started his practice before 20 years. Now there are a lot of good options available, safer options available, but still he continues to use that. And why he continues to use the same? Because that is again a thinking trap, which is called the status quo error. The tendency to prefer things to stay the same rather than changing it, even when change might be better. Dr. Atul will continue using it because he has used it for a few years. He doesn't want to change because he succumbed to the status quo error. So all these examples explains you that these thinking traps affect our diagnostic and decision-making ability. Coming to the last point, how can we prevent these thinking traps? First of all, we need to be aware that such possibility are there, such thinking traps are there. And today, my aim was to make you aware that such things are there. And whenever you make a decision, you need to think that I am not succumbing to this thinking error. Compare our decisions with others' decision. I'm trying to say that if your decision is different all the time, then you have to think that is there any thinking trap is responsible for same, something like what I described, the Maslow's hammer. If there is a difference, ask why. Also, we need to learn from other person's mistake. When I say mistake, means when someone does something wrong, instead of asking what did he do wrong, we need to ask why did he do it. So when we think why, we realize that most of the time these decisions are based on the thinking trap, and that results into the wrong decision. So the take-home message is the thinking traps are very common. As I mentioned, 80 to 90% of the decisions are wrong many a times, and that's because of these thinking traps. This can occur to everyone. No one is immune to this. Ultimately, that results into the problem in diagnostic ability and our decision-making ability. And ultimately, our decisions are affected. And the awareness is the first step. And this lecture is about the awareness that this or such problems can take place. Yeah, so I would like to end my talk, and I will be happy to answer any questions related to this.
Thank you very much, sir. So, while we are waiting for questions, sir, the one thing actually why this seeing the topic, you have very well explained most of the thing which we have not expected also. So, the one thing like in exams, sir, sometimes what our teachers used to say that rare diagnosis is rarely correct, so say only common things. So after watching this one,
Yeah,
is
that's
that
also
according
a
to you, sir,
very,
that
very
holds
error. Yeah,
good?
yeah, absolutely. So, like I usually tell my students that if you are in Ahmedabad and you are asked which animal is common, then think about the dog or a cow. They are much more common. The tigers are not common in Ahmedabad. So exactly that is what is matching with that. That don't make a rare diagnosis. It's a possibility, but it comes very late. Think about the common possibility. Yeah, so that everyone should remember, particularly while appearing in the exam, that try to think about the common diagnosis first rather than a rare diagnosis.
Yes, sir. And so when like we start the practice or when we are in post graduation, then the experience what we used to have is quite less. Like we have seen not all the cases. So our mind thinks only those things which we have seen
Yeah, or
before.
about, so mind makes the diagnosis, or I sees only what mind knows. And when mind knows only limited thing, our diagnostic ability is also very little. This I checked every time when I take the lecture of a physiotherapy student of a shoulder condition. I ask them about how many conditions you know about shoulder, and most of the therapists, they students, they come with the answer that they know probably 2 or 3 conditions: the rotator cuff tear, adhesive capsulitis. That's all. They don't know anything beyond that. And when you don't have anything in a differential diagnosis category, naturally you will try to make diagnosis for only 2 things which you know. So yes, again, that's very common that if you don't know many conditions, you would just succumb to the trap and you will try to make wrong diagnosis. So again, it's very important that we see as many conditions as possible. If during your training this has not happened, then we need to attend the CME, we need to attend the clinical meetings in which such cases are shown, so that you can understand that it's not only the few conditions which can happen.
Yeah, and sir, often we remember only those things which we have seen before, not what all we have read. During practical exam, it's quite difficult to relate those things.
Yeah,
So,
so again, there are various thinking traps. They are playing role. Whatever you see that comes to your mind first, that's called the primacy effect. The information which is shown to you first, that you will remember. So the first case of my first day of orthopedic training will remember. I will remember it much better than the other cases. So yes, that's also going to be very important, even though it's a rare case, but I will remember that case very well because it's the first information offered to me.
okay, sir. And sir, is this also a fact that when we see the files, case file, if it is like while we are examining the X-ray or case file, so according to you, is it help to the to the examinee to see it before, or he should see it later? Because most of the people say that you should not see. But according to you, sir,
Yeah,
because that
okay.
is
So
also an
that's
information. Yeah.
yeah, so that's again a good question. I would say a very intelligent question because we know that our mind is designed, or during training we are first take the history, then we take the clinical examination, and ultimately, if required, then we go for investigation. So this is how our training usually go. When there is an investigation, we have a tendency to take shortcut, and instead of taking adequate history or examining the patient, straightway we jump to the investigation. Fine, definitely we will be able to make diagnosis, but many times we missed a lot of important information which is available only by history and by clinical examination. So I would strongly say no, please don't take x-rays first. Just listen to the patient. That's very important because it gives a lot of information. But having said that, I have also made that mistake of looking at the investigations first. But that's my mistake, and I admit that.
And so, according if related to your talks, but in the initial few slides, as you have shown that the last person, if someone like few people says some wrong answer before, then the decision changes. So in that way, in our mind, it comes like team approach is like better than the individual approach. What we say.
Okay, that's
So
another very good question. And yes, so team approach has definitely advantage. But if everyone is giving their input, then it's useful. But when one or two person says X and then everyone is following the same, then that team is not going to be of any value. So if everyone is agreeing all the time in your team, then you need to be careful that this team is not going to help. So that's very important for the team. If, like you say, that we have so much harmony in our team that whenever there is a proposal, everyone agrees to that. No, that's a sign of warning, because if everyone is agrees all the time, then that's not the correct way, because either everyone is trying to please everyone so that they don't want to say something different, or they all are succumbing to conformity bias that we discussed in the first example. So that we should remember that thing. And another thing is like the best approach for the resident, the morning round, where the cases are presented, and when the different specialists, the different team members, they are trying to give their views, then it's very important. But if everyone is saying the one thing, then that is not going to be of great help to anyone. So in a team, if someone says that yes, I put this proposal, and everyone says that yes, let's do it, then this is we are going in a wrong direction.
So we should have a critical thinking in the
Yes,
team.
exactly. Critical thinking, and all the time when there is important decision, we need to follow the slow decision or the slow thinking. Means you analyze every aspect related to that, and then you come to the decision.
Okay, thank you very much, sir. I think we have almost 7:55. So, sir,
Yeah.
I
So
take your
thank you very
permission
much
to,
once again
yeah,
for inviting me. And let me tell the PGs once again that you may be thinking that this lecture is not helpful to you for passing. Please understand that it is not for passing, it is more for practice, and also have a broader vision. It also applies to life. So please take that message, and I'm sure that it would be definitely helpful to you. Thank you.
yeah, it's really great, sir, because we have learned a lot while you are explaining the things. So, thank you very much, sir.
Yeah,
It was
thank
great,
you.
sir.
Yeah, bye.
Thank you, sir.
Yeah, thank you.